Okay, welcome everyone to knee injury prevention and rehabilitation for fitness professionals. A lot of stuff to get through today. What I'm going to try and share with you is a pretty standard format that I've done over the last couple of years. We have about an hour or so at the start of the presentation on functional anatomy, a bit about injuries and common things that you guys will see and that we'll see. We'll then spend the last half of the presentation talking about specific rehabilitation programs, what exercises you probably should avoid in your weight training programs or exercise programs, what things you may do more of, and trying to put the whole rehab plan together, if you like. So that's kind of our format. So the first half is functional anatomy, physiology, second half is practical application of that knowledge. You've got a lot of stuff in your notes there. We're going to start with the anatomy information first for the knee. If you have a look through on the first page of your notes, you'll see a basic knee front view. We'll give you a quick look at it up here first. You've got exactly the same thing in your notes. Anyone know if this is a right or a left knee? Rob, one of our physios, you can't answer this question. Right or left knee? Looking from the front? Right or left? Right. Right knee? How do you know it's a right knee? How do you know it's a right knee?
Oh, the medial ligaments on the...
Okay, we've got the medial ligament on this side. The main thing to think about over here when you look at it is basically you've got this big bone down here, the fibula, and that's always on the lateral side. You can find that yourself. So if you go around to the bottom of your knee or around the outside of your knee, you find a big knob of bone just there. It's called the head of your fibula. Okay, and that's always on the lateral side. The other thing we've got here, have a look on the outside of the knee, sorry, we've got this very strong lateral collateral ligament. It's a very, very strong tight band. And if you look at it on my little model here, everyone see that strummy thing just there? That's your lateral collateral ligament. Now unfortunately, again this as I can say is a right knee, late last year I did exactly a pretty severe injury to that and ruptured that lateral ligament. How do you think I'd tear a lateral ligament of the knee? What would I have to do to my foot, do you think, to rupture that ligament?
A strong lateral movement or what, a twist?
Yeah, you think about which way it's going to stop. Is it going to stop the movement that way or that way? When's it tight? When my foot goes towards the inside. So can you see if I'm planted on my right foot and someone hits me from that side, you see that could potentially stretch or tear that lateral ligament. I did exactly that. I actually planted my foot, so I planted my foot and my knee kept going that way and my foot stopped, so it did that really sharply. And I pulled the lateral ligament right off the fibula. So that's pretty hard to do because that's a pretty strong sucker. It's a very strong, thick band of tissue. It's hard to tear that. If you go to the inside of the knee, see that one? Obviously the medial ligament, it's on the medial side of the knee. It's going to prevent exactly the opposite movement. It's going to prevent the lower leg from going that way. Okay, now you can understand it really from physiology, if you watch the football a fair bit, which person or which ligament is going to be injured more likely. And it's going to be the medial ligament because people are hit from the side in football sports or contact sports. So if I plant my foot, someone hits me from the side, which is easier to get at than someone coming from inside out, okay, I'm going to rupture that medial ligament. And it's a different sort. See how long and fleshy it is? See how long and broad? It's nowhere near as thick and tight as that thing. So it's a lot more spread out and it's not as strong. Okay, so it's easier to damage that ligament than it is the lateral ligament, but you can do them both.